Are all post-concussion cognitive issues treated equally? No. And it really depends on who your provider is. The way that I see post-concussion cognitive issues is that not all cognitive problems are actually cognitive problems. So what somebody may perceive as a memory impairment is not actually a memory impairment. Patients that let's say, somebody that is, because of concussion, because of the media that's kind of grabbed a hold of this, anyone with a concussion starts to get very worried that they're going to have long-term problems or that it's going to affect their brain function and all these different things. Concussion is a very short duration injury. Concussion creates this metabolic energy deficit, which recovers within a fairly short period of time. Now, the symptoms of concussion in some patients, between 30 and 40% of patients now, can last a little bit longer. And the reason for that is there's kind of five main reasons why they would have persistent symptoms. I'm combining categories to make it five, but essentially you're dealing with blood flow issues, autonomic issues, visual or vestibular issues, which I lump in as one, neck issues or cervicogenic issues, inflammation, like I said before, hormone imbalances are becoming more well known and more well studied, and we're finding a lot of hormone imbalances that can be treated with hormone replacement therapies and things. And the last one is the psychological. And to say psychological, people get their back up against that and say, well, I'm saying that it's all in your head. I'm not saying that it's all in your head. I'm saying that your mind is very powerful and can contribute to these issues. Also, we know that patients that have pre-existing anxiety and pre-existing depression tend to take longer to recover because the symptoms tend to overlap with those conditions and concussion. So it becomes difficult to separate what is what, particularly if you have a pre-existing condition. But the other issue that happens is that because you're kind of now primed to think that your memory may be affected, people start looking for things within their day-to-day that shows that maybe their memory is impaired. So if you think, it becomes a self-fulfilling prophecy in a way. So if you think that because I have a concussion, that might affect my memory, and then you're looking throughout your day, and let's say you walk into a room and forget why you came into that room. You might immediately think, oh my God, what did I come in here for? And then start thinking, oh my God, my concussion, my memory. And then you start to think that you have a memory impairment. But this is something that happens to everyone from time to time, right? I frequently will walk into a room and go, okay, what did I come in here for? Because you're not thinking about what you're doing. You're distracted. So a lot of times people that think they have memory problems will actually go and get tested for memory from a neuropsychologist that will find out that they actually have normal memory, right? So it depends on what your cognitive issue is. So when you say, are all cognitive issues treated equally? The answer is no. And the way that I approach this is, first, I'll put them through, is this a blood flow issue? Because sometimes if it's a blood flow issue and we get them exercising, that will improve the cognitive issues. So we don't need to go down the road of neuropsychologists and all this stuff, because once we do that, all of a sudden they feel that their cognitive issues have come back. They have gone away, sorry. Or maybe you change their diet, and as soon as you change their diet, they feel that their mind is sharper. They're not having concentration difficulties anymore. They're able to focus better. Maybe it's a vestibular problem. Maybe they're not seeing the paper right when they're reading it, so they're reading books and they're reading newspapers and they're online, but they're not able to grasp what they're reading, and they think they have a cognitive problem, but really they have an ocular motor problem. And if we can fix how that works, all of a sudden now they're able to retain the information because they're seeing it properly. Right? So we have to basically go down the list of finding out why the person is having the issues in the first place. If we say, okay, your blood flow issue is fixed, you're no longer having any visual or ocular issues, your vestibular problems are gone, your headaches are now gone, and the symptoms that are lingering are still cognitive or fogginess, then we say, okay, we're going to get a neuropsychologist to take a look at this and involve a neuropsych in the case. Sometimes we'll do that early on, depending on the case, right? So not all cognitive issues are treated equally. It really depends on the case.